Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, Fairfield Medical Center, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.
Welcome to Fairhope Hospice Today. I'm Kristin, President and CEO here at Fairhope Hospice and Palliative Care, home of the Pickering House, and we are here today at the Pickering House in the sunroom. It's a beautiful day outside. I've got a very special guest with me, Dr. Brian Varney.
Good morning.
Hi, how are you?
Very well, thank you. Thanks for having me.
Thank you for joining us. We were just talking that we get to do this a couple of times a year, and we were just saying, well, I wonder if we say often the things over and over that we want people to hear, but I think that's always important, that people can hear things multiple times, different ways. So I think it's a good day to kind of just revisit what we do and why we do things.
Absolutely.
So this month in November is National Hospice and Palliative Care Month, and we wanted to talk a little bit about just the misconceptions and myths that people have about hospice care and what that means. And so, I thought I would just give you a second to kind of introduce yourself, tell you how you joined our team, and how long you've been with us.
Absolutely. My name is Dr. Brian Varney. I'm actually a family practice physician by training, but basically a geriatrician by trade. My basic service that I provide is to elder care in the homes and in the nursing homes. And a big part of what I do is working with Fairhope Hospice as the medical director here. I did my training at Grant Medical Center in Columbus, Ohio. And when I graduated and came down to the Lancaster area, I found very quickly that the community is very much an older and aging community. And my practice niched itself very quickly into care for the elders. And before I really even got all that busy with my own office, I wandered into the old office for Fairhope, which is down by the Kroger in the parking lot there, and went in and met the CEO then, Denise Bauer, and I started volunteering with the Fairhope service at that time. After several years, they offered me a position here. It's sort of like the stray dog you feed and they never go away.
Right.
So they started feeding me, and I decided to never go away. So when Dr. Roach retired several years ago, I was promoted to the chief medical director, and I've told people jokingly that I will leave Fairhope Hospice when I leave from one of these rooms here in the Pickering House.
Well, yeah, we've talked about that, haven't we?
Yes.
I'm curious what made you decide to kind of venture into the building and ask to volunteer?
Well, hospice always reached out to me. It was almost a drawing or a calling. In my training days, very early on, I was paired up with Tim Moore, who is a hematologist oncologist at Grant Medical Center, and part of my tasks there working with him was helping him to develop the palliative care unit there at Grant Medical Center.
Okay.
So that was an early exposure. And even as a medical student before then, I ended up doing rotations with doctors who provided hospice care. It seemed like every time I went to a rural community and was paired up with a primary care physician for mentoring, there was some type of a hospice connection. I even worked with the doctor in Newark, she was the medical director up there for a very long time. And just watching these folks do what they do, it drew me. I never really had a personal experience with hospice until 2012 or 2013 when my own father passed away. He was on a hospice service down in Southern Ohio. So it wasn't like this personal thing my whole life. It just, in my training and my career, I was just drawn this direction.
Yeah, you know, I've talked about that a lot when it comes to medical students and your support and your guidance. When, we have medical students that you have worked with that have come to Fairhope and really learned all aspects of what we do, from the nurses, social workers, chaplains, to understand what that holistic type of hospice care is. So I think that's really important, and you and I have talked about, I mean, it really changed the way, the plan for your career, I would imagine.
Right, it sure did. And I really enjoy those opportunities to teach and to share. It's my honor to be able to work with the young doctors coming up, and I just hope that in the future I get to work with more of them. One of the things that we've shared recently is how oftentimes people come to hospice care very late in the game. We will sometimes get a referral for someone and begin to provide services, and they pass away the same day or within a number of days, sometimes within hours. And it just seems like we don't really get the opportunity to touch that family and that patient and provide a lot of the anticipatory type teaching and guidance and care and the comfort that comes along with what we do so well. Yeah. I just really hope that going forward we can provide a really good educational foundation for the young doctors so that those referrals can come a little sooner, so we can get involved sooner, so we can do a better job helping not only the patient but the whole family.
Yeah, I really feel like that's been a topic that you and I have talked about for a long time, and I talk about it weekly on the radio, just the importance of quality of life. And, I think that I have some things that I want to talk about that are myths, and I think one of those myths are that people feel like once they sign on to a hospice program that's a death sentence, or it is their end of life. And we really have found, and I know you can speak to this, that when someone signs on hospice, oftentimes it extends their quality of life, but even their days.
Right.
Fairhope and hospices alleviate those trips back and forth to the hospital and the type of comfort, and we just keep those symptoms under control.
Right.
But you've got that holistic approach. So not only are we looking at and treating the physical discomfort, but it's also the other pieces, the spiritual concerns, the family dynamic. So it's not just always about that comfort piece, it's about the whole picture. And if that's one message I could say every day is, don't wait until it's too late. Let us come on board and help walk you through that process for months.
Exactly. And it's not, like you alluded to, it's not all about medication. We're not simply treating symptoms. And with a lot of medical conditions, when you provide a level of comfort, they do live longer. They do have better quality of life, obviously, is what we're kind of focused on. But there have been studies which have shown congestive heart failure, COPD, people at that very end chapter of those disease processes, they will decline more rapidly when their symptoms aren't managed. And we get their symptoms managed, they breathe a little easier. Then they have also the care providers that are coming to their home, the nurse aides that are helping them around the house, the nurses who are providing the advice through the physicians as far as symptom management. And they do actually get a little fine-tuned, if you will, so that those final days are not only more comfortable, but they do sometimes enjoy a longer time with their families.
Don't you see that when those symptoms for that pain or discomfort, or like you talked about the COPD, and where people are working so hard to breathe or handle that pain, that it really just takes all the energy out, and it affects all other, a lot of their systems.
Yes, very much so.
And that's what we see. Yeah.
One of my patients that I recall very fondly had really bad lung condition. And with her breathing, the work of breathing, she was just losing weight constantly. No matter how much she ate, she had a really good appetite, but she kept losing weight because just the work of breathing. You get that breathing work under control and get them comfortable, and then everything else can kind of stabilize around that.
Yeah. Since we're talking about diagnoses, one of the myths that we hear often is that people feel like they have to have a diagnosis of cancer to be accepted onto hospice. Myth?
Very, very much a myth.
Okay.
And actually one of the most common myths. A lot of folks are mistaken that hospice only means cancer. And actually the majority of our patients on our service are not cancer-related diagnoses. We have a lot of neurologic diagnoses, stroke syndromes, dementias, the Parkinson's, ALS, any of the breathing conditions, COPD, heart conditions, CHF, coronary artery disease, and you name it, HIV disease, any of the birth type processes that lead to a shortened life. All of those can be cared for. Basically, if your prognosis is 6 months or less, you're appropriate for hospice care for whatever that disease process.
And the really important part to note about that is the patients, the families, even the physicians don't have to be experts on does that diagnosis fit.
Right.
That's why we have you. That's why we have Dr. Singer, Dr. Dag Murray. You will help us. And with one phone call, all you have to do is make one phone call, give us that information, and let us guide you what the correct diagnosis is. Are you appropriate? Are you ready for hospice? So that's really the beauty of having our team here at Fairhope.
Right. One phone call and we can take a little bit of information and very quickly come to a conclusion of whether or not we can help you, or if it's not time for us yet, we can certainly make another recommendation.
Right. So let's give you that phone number. The phone number is 740-654-7077. You can go onto our website, which is fairhopehospice.org, or you can call 800-994-7077. We'll be right back. It is so important for families to feel comfortable and safe when they call, because oftentimes that first phone call, even picking up the phone physically and just dialing that number, is very hard. You're asking for something that is a very difficult and private decision, and so we want everyone to feel comfortable and safe that you pick up that phone, you make that phone call, and let us just guide you and lead you where you want. And then you can make an informed decision about what's best for you and your family.
Can I visit my doctor online?
Our providers offer telehealth appointments that fit your schedule, allowing you to get the care you need when you need it. Whatever you're searching for, you can find it at Fairfield Medical Center. You walked down the aisle and promised happily ever after. Sometimes happily ever after means ending a relationship. We know the conversations are not easy. Deciding what's best for you, your children, and your next steps takes work and communication. At Dagger Law, we know there are no monsters in a divorce, only people trying to find their way. Local, trusted, experienced. Dagger Law.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our two locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Hey Bobo, do trees tell each other stories?
I'm sorry, I'm afraid I don't know that.
Hey, why don't we go find out? Listen.
Do clouds take naps?
I couldn't tell you.
Dad, do stars visit their friends?
Look!
The staff that have been here know what it takes. They've been on the other side. They see what it takes to make someone comfortable, to make the family comfortable, and really what kind of support they need. And so I think that's what really makes Fairhope what it is. Welcome back to Fairhope Hospice Today. Thanks for joining us and happy Thanksgiving. I have with me today Dr. Brian Varney, and we are discussing myths and misconceptions about hospice care in general. So thank you for taking some time with us today.
Happy to be here.
Yeah. I thought what we would do is we have some thoughts and some myths that often will come to our attention when we're meeting with families, talking with families. So I thought we would go over a couple of those. You ready?
Absolutely.
All right. So one thing that we often hear is that patients can only receive hospice care for a limited amount of time.
Right.
That's a little complex, but why don't you walk us through just a little bit how what that looks like?
Certainly. There really is no life cap limit to your benefit with hospice services. Now, we are under regulations as far as Medicare is concerned and who's appropriate for hospice and for what diagnoses and what criteria. So all of that is pretty easy. That's the cookie cutter kind of a decision making. But as far as being limited, it really isn't. The guidelines are if you have a 6 months prognosis for end-of-life care, then you meet criteria. You're appropriate for hospice care. That doesn't mean that if you don't die within 6 months that it just gets cut off. There's a whole process we go through with certification when someone first comes onto our services, and basically we determine them to be appropriate for care. And at the end of a certain period of time, the first benefit period is 90 days, the second period is 90 days, and thereafter those benefit periods are shortened to 60 days. If you go beyond those first 2 benefit periods, beyond 6 months, it doesn't mean that it ends. It just means that we have to take a real close look at the whole situation and apply diagnostic criteria and prognostic criteria to show that you still are appropriate. If your prognosis still remains short, then you can be recertified, and those can be indefinite as long as certain criteria are met as far as a prognosis.
And you know, sometimes it's funny and interesting because some people will say, well, you know, you don't have a crystal ball. How can you tell that someone has 6 months or less left to live? And you know, one thing that I say is if that disease follows its normal course or projected normal course. So, you know, everybody's different. Everybody has different factors in how that's going to look. And like you said, I love the fact that we as a team, the nurses, the aides, the social workers, look at that whole picture and say, yes, they've had a little bit of a decline. It's been 6 months, but it appears that that decline will continue. Maybe it's going to be more gradual for some more than others.
Exactly. A lot of times it does from the outside look like crystal ball, looks like prophesying. However, it has been very well studied, and there are diagnostic criteria and prognostic criteria which CMS provides us, and then we translate those into our own local criteria for determination. And there is a lot of science to it. There's some art, but a lot of it is meeting certain weight, BMIs, protein levels, and then a lot of criteria that are just disease specific, such as for cancers, metastases, and etc.
I hear sometimes we meet every week and we discuss our patients, and sometimes we'll hear the nurses or the aides may say, well, so-and-so, you know, 2 weeks ago they were walking from the bathroom to the kitchen. Now they can't make it there without taking a break, or their clothes appear to be looser fitting. So those are some of the things. That's not scientific, but it falls into that whole piece of looking at that condition as they may be slowly declining.
The movement really nowadays is toward painting a picture and looking at the whole patient rather than just looking at checking boxes and adding up numbers. We look at the whole patient and their overall situation, and we do want to, when we receive a report from a visiting nurse in the home, we want to have them basically paint us a picture. We want their report to be very colorful, very descriptive, and give us all the markers that we need so that in our mind, if we're not there seeing them for ourselves, we can see the patient.
They're your eyes and ears. And
exactly.
Yeah, right.
There are senses in the field.
They are. All right, you ready for another myth?
Sure.
This myth says that hospice is a place.
Hospice is a place.
So where does Fairhope provide care? Because hospice is not a place. It's a hospice care is a philosophy. So hospice, Fairhope Hospice, we provide care in all different places.
We sure do. And when I think about that, when you said it's a place, the first thing that comes to mind is, for me, alluding back to the first segment where you talked about the spiritual side of things. If you think about in spirituality, Christianity, and the church is not the building, the church is the people.
Right.
And it's very, very much like this myth. The hospice is not the building. We refer to this as the hospice. This is the Pickering House, which is a hospice inpatient facility. But hospice is the people and the care that they provide. Hospice includes the chaplains, the nurses, the social workers, the doctors, the aides. We all kind of work together to provide the best care we can for end of life. And we come to you wherever you are. If you need to come to us, we'll take care of you here in the Pickering House for certain types of care needs. But by far and large, it is obviously not a place. It is a system of care delivery which can meet you and effectively provide end-of-life care anywhere in any setting.
Right, and something that we love to say is wherever you call home is where we're going to meet you.
Right.
Whatever home looks like to you, wherever you lay your head at night, that's where
Nursing
that's where Fairhope
homes,
will be.
assisted livings, trailer courts.
Right.
In the hospital, obviously, in our inpatient facility.
Yeah.
We've even gone into campers in people's backyards.
Right.
We've gone into homeless shelters.
Right. It doesn't matter. If someone needs end-of-life care, they need comfort measures. That's what hospice is. That's
Exactly.
what Fairhope is. Yeah. Okay, we've got another one here. Hospice means giving up hope or that death will happen very soon.
Well, certainly not giving up hope. We realize that if you've been referred to hospice, that you have a terminal condition. We can't change that. A lot of that stuff is bigger than us. But what we're here for is to take care of those arrangements, that planning, the anticipatory guidance, teaching you, educating you and your caregivers as far as what to expect and how to manage those changes as they happen. It's certainly not just giving up hope, because what we want to do is make sure that what you have left on this earth is as good as it can possibly be, and also to help make arrangements and help those who are going to be left behind be prepared and be ready to move on.
Right. You know, I think it's so important that we forget sometimes that we do this every day. Our staff do this every day. You know, oftentimes when families are going through this, they've never done this before. There's a lot of questions. There's a lot of things that they don't know how to do or where to turn. And so it isn't giving up hope. It's reaching out. It's letting us guide you, letting us give you those tools to make that last time that you have together with your family meaningful.
Right.
Yeah. Okay, well, let me give you the number real quick. If you have any questions about what Fairhope does, how we can help you, please call 740-654-7077. All right, so when a patient, next myth, when a patient elects hospice, he or she can no longer receive care from their primary care physician. That's a big question.
That is, and that one is as much a myth with the physicians sometimes as it is with the patients and the families. A lot of doctors won't refer because they don't want to lose that relationship, and patients will be resistant to take that referral because they don't want to lose that relationship. The relationship between a primary care doctor and a patient is an intimate relationship. You share things in that relationship that you don't share with your most beloved.
Right.
So we would never interrupt that. We want the primary care physicians to stay involved. We work with the primary care team very closely, hand in hand. There are different ways to handle it. There are some doctors who really aren't comfortable dealing with end of life. They don't like having those conversations, and they can take that hands-off approach. They can say, this is my patient, I want you to manage everything, but just kind of keep me informed. And that's okay. We also have doctors who are very territorial and possessive, and we want your hospice services, but I want to still be in charge of everything. And then we have some who have this blend of, you can help out with this, but I'll still take care of that. And it's all okay. We want to keep primary care involved as much as they want to be involved.
Well, and like you said, it's those relationships that you build over years. And I don't know if you feel this as a physician, but I would imagine that oftentimes it's really difficult for physicians to get to the point with somebody that they've had an extensive relationship, for them to say, okay, I think it's time that we talk about, you know, I can't fix this. You're not going to get better.
Yeah.
It's hard to have that conversation.
It is.
What do you do if your physician can't have that conversation? Maybe you know as a patient that you need something more. How do you handle that?
Well, you kind of have to be your own best advocate.
Okay.
And it's okay to bring up those topics yourself with your clinician, with your nurse practitioner or your doctor. It's also okay to just call us. If you feel that there's something going on that you think you're at that stage of life, you can self-refer and we can reach out to your doctor for you on your behalf. So that's one way to go about that. But it's really just you know, having those conversations. You know, just kind of getting to the point where we're comfortable having those conversations, talking about death.
Okay. Not easy.
It isn't.
It takes lots of education. All right. So I want to touch just a little bit on the fact that it says the myth is that all hospices are exactly the same. Can I take that one?
By all means.
All right. So for me, for all hospices have regulatory things that they need to comply with. Medicare says that we need to do particular things a certain way. We all have those. But to me, hospices are very different. And
Right.
I think you see that. Obviously, you're here with us. But the things that we offer that maybe other hospices offer, but in a different way, everything that we do every day is what's best for the patient. When someone comes to me, and I know you're the same way, when they come to us and they say, hey, I really think this patient needs this, this, or this, our first thing is what's best for the patient.
Right.
It's never about how much does it cost or, the other questions. It is exactly about what's going to be best for that patient and that family. And I pride myself on that, and that we have the ability to do that, and our staff know that. Not only that, but we have such a great team, a full, complete team available all the time, 24/7. Our nurses, we have nurse practitioners for palliative, which I don't know if we have enough time today to talk about palliative. But the other piece that we have great volunteers, active, great volunteers. And then we have our grief team, our grief support team. They go above and beyond. Medicare regulations say that we have to provide care for 13 months after a family or after a patient passes away. We do a lot more than that. We provide free of charge, never a charge, to our community, to our schools, to our families. We have groups. So I feel like that's where our hospice is different, and not all hospices are the same.
I've worked with a few in my training days, and definitely I'm very happy with this organization. I can't imagine being anywhere else. Of all the hats that I wear in the county, of all the jobs that I do, and there are several, this is what I love the most. This is what I feel is my mission, is what God put me here for. And honestly, if I have to give up everything else, I hope that I can hang on to this to the very last day that I work.
Me too. I hope you keep that hat on for a long time.
Absolutely.
So let me give you that phone number one more time. The phone number to call is 740-654-7077. You can also call 800-994-7077. Follow us on Facebook. You can also go to our website, which is fairhopehospice.org. And I need to ask you a last question.
Yes.
Tell me how you celebrate life. You have a hard job. You do a great job with our staff. We appreciate you. We love you. We love what our physicians do for us. But how do you celebrate life?
Well, I've always kind of had that attitude of work hard, play hard. You could probably consider me a workaholic, and it can be my weakness sometimes. But at the same time, I love what I do. As a little boy on my grandpa's lap, he quoted me. I know it's somebody else's quote, obviously, but he said, "Son, you find a job you like to do, you never work another day of your life." I'm not working. I get to come and have fun everywhere I go and get paid for it. So that's just a celebration. Every day of my life, I get to touch people's lives. I get to share with them some of the most intimate details of their lives. I get to hear the stories of our World War II veterans and the Aleutian Islands and D-Day, and just colorful stories that you cannot get out of a history book. So every day is a celebration when it comes to that.
Good. I love to hear that. And we have one chance to do things right, and you're a huge part of that, and we thank you for that, as well as Dr. Barbara Singer, Dr. Dag Murray, Dr. Bonza. So thank you for that.
It's a blessing to be part of the team.
Thank you. Thank you for tuning in to Fairhope Hospice today. And remember, celebrate life.
Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, Fairfield Medical Center, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.